Good day, everyone. Let's continue our visual diagnosis on pale lips and red lips. The, the color of the lips primarily reflects the state of the spleen, heart, and liver. It also reflects conditions of blood deficiency, yang deficiency, and heat and blood stasis. The normal lips, like the complexion, should be pale red and slightly moist, not swollen, not withered, not contracted, and not quivering. The normal pale red color of the lips reflects the normal condition of qi and blood. Their moistness reflects the normal condition of the body fluids, and their normal movements reflects a normal condition of the mind and spirit. Pale lips. When the lips are paler than the normal pale red, they indicate either blood or yang deficiency of the spleen or liver. In cases of blood deficiency, especially of the liver, they might also be slightly dry, whereas in cases of yang deficiency, they are usually moist, pale grayish lips. The color of the paper indicates severe blood deficiency. Deficiency of blood, deficiency of qi and blood of the spleen. Okay, pale lips, dull pale complexion, poor appetite, light abdominal distension after eating, tiredness, lassitude, weakness of the limbs, loose stools, thin body, scanty periods, or amenorrhea. Insomnia, joint ache, and the tongue is pale, and the pulse is weak or choppy. Liver blood deficiency. Okay. Pale lips, dull pale complexion, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull pale complexion, and the tongue is pale, and the pulse is choppy or fine. Let's talk about spleen yang deficiency with the empty cold. Pale and slightly bluish lips or bright white lips. Pale complexion, poor appetite, slight abdominal distension after eating, abdominal pain, tiredness, lassitude, weakness of the limbs, loose stools, feeling of cold, cold limbs, pale and wet tongue, and the pulse is deep, weak, slow. Okay, let's talk about description, indication, and pathomechanism. Pale lips and the tongue, it is indicated blood deficiency. Pale lips with fatigue, it is an indication of qi deficiency. Pale withered lips, usually seen in critical condition, indication of qi depletion. These three, blood deficiency, qi deficiency, qi depletion, the pathomechanism of these three is red is the color of the blood. When blood deficiency fails to fill the lips or qi deficiency cannot push the blood up to the lips, they lose red color. And lastly, pale lips and face with sensation of cold. It is an indication of deficiency cold. And the pathomechanism, blood lacks of power to push or cold causes vessels to contract. Okay, let's talk about red lips. Red lips are always caused by heat, which can be full or empty and acute or chronic. Full heat or full heat of most organs and especially lungs, heat stomach, liver, kidney, and spleen may cause the lips to be red and swollen. Empty heat of the same organs may cause the lips to be red and dry. Acute invasion of wind heat may also cause the lips to become bright red. But this happens mostly in children. At the chill level of acute febrile disease, the lips also become bright red, and they also crack and dry in cases of fire. Talk about full heat. Okay, red and swollen lips. Thirst, dry stools, feeling of heat, red tongue with yellow coating, overflowing rapid pulse, heat in the heart, lungs, stomach, liver, kidneys, and spleen all may cause red lips. Other symptoms and signs depend on the organ involved. Yin deficiency with empty heat. Okay. Red, crack, and dry lips, dry mouth, thirst with desire to drink in small sips, feeling of heat in the evening, night sweating, 5-pound heat, red tongue without coating, bloating empty and rapid pulse, empty heat in the heart, lungs, stomach, liver, kidneys, and spleen all may cause red lips. Other symptoms and signs depend on the organ involved. Now, let's talk about the invasion of wind heat. Red lips, especially in the children. Aversion to cold, fever, sore throat, headache, body ache, slight sweating, tongue with red sides and or pronged, and the pulse is floating rapid. Okay, acute heat at the chi level and febrile disease or heat. Red and swollen lips, fever, a feeling of heat, throwing of bedclothes, thirst, profuse sweating, red tongue with yellow coating, and the pulse is overflowing rapid. Okay, let's talk about acute heat at the chi level in febrile disease, fire. Red, swollen, dry, and cracked lips, fever, feeling of heat, thirst, dry mouth, dry stools, dark urine, mental restlessness, red tongue with dry, dark yellow, or brown coating. And the pulse is deep, full, rapid. Okay, this is the description, indications, and pathomechanism. Okay, dry and crimson lips. It is an indication of inferior heat. Bright red lips. It is an indication of heat toxin. Crimson lips. It is an indication of deficiency heat. And there's three: interior heat toxin, deficiency heat. The pathomechanism is the color of heat and fire is red. Heat endures and concentrates the yin and blood. Okay, description is that cherry-colored lips. This is an indication of gas poisoning. And the pathomechanism is toxin damages the blood cell, changing its color. Thank you for your attention. Have a good day.